Hey, everybody. Welcome to Ron's Teachable Talks. We have another interesting topic today. Ron, you ready for it?
I'm ready.
Okay, awesome. So, as everyone has been watching, most likely it is one of the number one shows, miniseries on Netflix is Painkiller. And it's all about the opioid epidemic in our country, but how it came to be, how these opioids have gotten into circulation and why people have gotten such wide use out of it, easy access. So, Ron, what is your thoughts about painkiller and people becoming dependent on opioids? But do you have anything in your arsenal, directional preferences, what people can do for chronic pain? What are some of your thoughts about this?
Yeah. Well, having watched the series myself, one of the most shocking statistics at the end of the series was that they think over 300,000 people have died from overdoses of this drug. And many of them started out very innocently with a back injury or some type of serious back problem or injury. And they were given these drugs, and the doctors thought they were giving them correctly, but they really didn't understand the true potential of these drugs and how they could be abused. And so I was reading an article by a doctor from Missouri who is a McKenzie trained doctor, which, we use the directional preference exercises. And he said the key thing you have to do is find the source of the problem and not just treat the symptoms. And that's what we do, those of us who are trained in the McKenzie Method. And in the year 2020, an amazing statistic was that $1.5 trillion was spent on the epidemic of the opioid crisis. Just a phenomenal amount of money. And that's not counting all the damage to the lives that were involved. And I think that if physical therapy could be instituted early on before going to any kind of injection or heavy pain medication like opioids, the results will be much better. In fact, one study said that opioid prescription would be 89% less if physical therapy was used first. Now, in terms of a patient, I had one who was on opioids, and she was using a drug called tramadol 4 times a day. She came in with this chronic back problem. And through the treatment process with directional preference exercises, she was able to reduce 4 times a day to 1. And she took it at night, and she did not want to try to get rid of that one at night because she had a bad experience one night waking up with pain, and she did not want to go through that again. I think she really could have got off of it, but she wasn't willing to. Yeah, they can really, the McKenzie exercise can really be effective, even after being on the meds for a long time. And then we try to get them to use the exercise in place of the medication, and it does the job. Many patients can get totally off of the meds if they do the exercises.
Yes, and that statistic is amazing because even what you have done was someone who had already been prescribed and was on them by also treating the core issue, not just the symptom. You helped her pain, but she was greatly able to reduce almost completely being off the opioid, which is amazing. So, right then and there, you have a really amazing example of
Mhm.
treating someone and being a part of that great statistic, Ron. So that's really fabulous. how long do you think it might typically take for a patient to get through some of these exercises, sessions, to start feeling a little bit better?
Yeah, usually within the first few visits, we see progress. And I always tell patients, if we don't see any progress in 5 visits, that we both agree that something is improving, then I'm going to send you back to the doctor, because I think I will have had a chance to try everything that I know from the physical therapy perspective and the directional preference exercise perspective. But then after that, it can vary from person to person. Most cases, I would say, are done in 10 to 12 visits. Some are less, some are a little more, but it doesn't take months and months of therapy, anything like that. It's usually within a 1 month to 2 month period, typically.
Wonderful. Ron, this is amazing insight. Appreciate you talking about a very heavy but also very important topic. And I'm sure a lot of people here really appreciate all the statistics that you have given and the advice. So thank you.
You're welcome.